Hello and welcome. My name is Dr. Shahrad Mabourakh, MD. I'm a physician here at West Broward Internal Medicine in Tamarac, Florida, and I practice general internal medicine or primary care medicine, if you will. Today I'm going to talk to you about continuity of care. In the last video I talked about the primary care world and how it's structured and who is it that you're seeing when you're seeing an internal medicine doctor. And today I want to talk to you about the breadth of medicine. So now you've seen the internal medicine doctor, and let's say they've diagnosed you with a medical problem and they've referred you to a subspecialist. So who are those subspecialists and how does it work? So let's start with the internal medicine doctor. So this is an internal medicine physician who's a primary care doctor. So in other words, a primary care internist. So I'm going to leave the family practitioners and general practitioners and the pediatrician, all that out. We're just going to talk about really the adult medicine world and who are all the subspecialists in there. So first of all, internal medicine has two worlds, the primary care world and then the subspecialist world. So once you've completed, again, your college and you completed your 4 years of medical school, and then you entered, let's say, internal medicine residency program, at some point you may decide to do primary care internal medicine, or you may become a subspecialist, we call it, not just a specialist, because internal medicine is actually a specialty. So you can become a subspecialist of internal medicine. And those, you've all heard of them. There's, of course, cardiology, which has moved so beautifully in the last 30 years that they've really accomplished some magnificent results with the angioplasty and stents that they do, saving many lives, pulling them out of acute myocardial infarctions or heart attacks and saving their lives and having the person walk out of the hospital in a few days perfectly good as new. Then you have pulmonary medicine. Of course, they deal with the lungs and renal, the kidneys. Then you have GI, but there are multiple other subspecialties of medicine, for example, rheumatology or infectious disease. And so we comprise internal medicine and its subspecialties. So if I have a person who comes into my office with, let's say, severe diabetes, especially type 1, which really requires very intensive insulin therapy, because I manage most of my type 2 diabetics, I might send them to endocrinology, and that's another subspecialty of internal medicine. All these folks, by the way, did the same thing that I did. They went to college, they went to medical school, they had a 3-year residency program in internal medicine, and then had either 2 or 3 years further of their subspecialty that they went into. Now, it's important to understand that as you see these subspecialists for the particular serious lung problem that you may have, your general internist should stay involved, because oftentimes, even though these folks really started out being internists, by becoming subspecialists, they've forgotten a lot of their general medicine. And their job is not to manage the total health care of the patient. Their job is not necessarily to coordinate care between the other branches of medicines that involve. So let's talk about those. So let's say now I have a person who needs a surgical intervention, and this happens often. Let's say my patients often need a joint replacement, so they go to an orthopedist. Orthopedic surgeon, of course, is a surgical branch of medicine. These two are separate. So when you're doing your 4 years of college, 4 years of medical school, then you apply to a residency program, here's where we separate. The medical people go to internal medicine residency and subspecialize. The surgical people go to a surgical subspecialty. They might go to general surgery and take out gallbladders and appendices and all that. They might go into cardiovascular surgery and do cardiac bypass surgery. They might go into orthopedics. They might go into ophthalmology or urology. There are multitude of subspecialties. Gynecology and obstetrics have their own world. And again, here we're not talking about pediatrics at all, because pediatrics has its own world of pediatricians and subspecialists in general pediatrics and surgeons that do only pediatric surgery. So this world is very large. And we haven't even talked about neurology, which has its own system combined with psychiatry. They go together. There was a time that, in fact, they had the same boards, And it seems peculiar to me because they're quite different from one another in terms of treatment, but neurology and psychiatry are still connected. And we said gynecology has its own world. Plastic surgery is a subspecialty of plastics. My brother's a plastic surgeon, so I better write that. And then so on and so forth. Now, what becomes quite apparent here that this system is very complicated. In fact, I mentioned ophthalmology. Now, there used to be just one ophthalmologist that you saw. But now we have at least 6 different types of ophthalmologists that I can mention. You have your corneal specialist that does corneal transplants and problems with the cornea. You have your retinal specialists who have become very, very busy because as we age, there's a lot of retinal problems, including degeneration of the retina having to do with age or diabetic retinopathy. Then, of course, you have your glaucoma specialists. Then you have specialists that deal with movement of the eye, movement disorders. And you have your plastic surgeons of the eye that lift eyelids. And believe it or not, each one of these doctors have created their own niche. So there are times when I refer a patient to 3 or 4 different ophthalmologists to take care of the multitude of eye problems that a person may have. So if this job is going to have to be done correctly, someone in the center has to manage all of this and frankly chooses physicians often because, for example, with me, I've been in practice for 30 years. I do know my physicians in this area quite well, and frankly, I know who might be better at handling a particular problem, a gastrointestinal problem, let's say, from ulcerative colitis. It's a very complex GI problem that not all GI doctors necessarily are good at dealing with or want to deal with it because it's rather complicated. Anyway, this is the world of internal medicine and its subspecialties. And the important thing is to create continuity of care. Now, we didn't talk about hospitalization at all because that's another issue that internal medicine doctors do. Family practitioners and general practitioners don't. They don't typically hospitalize their own patients. Most of our training is in the hospital. So I actually hospitalized my own patients, call in all these specialists when something complex comes around, carry that patient through the hospitalization, help them get into a rehab program if it's necessary, see them in the rehab program, continue the care until they're able to go home and I can see them in the office, and create full circle, complete control of what's happening to that patient so that we can get the best out of the complex healthcare that we have, hopefully using the best providers in that process. I wish you well. I hope you never have to use this system, but when and if you do, try to understand that you need an orchestra director that, one, you get to know well and get to know you, who can get the best out of the system for you. God bless you.